In the first part of the chapter 7 lecture, we talked about just the basic function of the immune system. And now in the second part, we're going to talk about immune disorders, problems with the immune system. So the learning objectives for this section, we're going to talk about common adverse effects of immunosuppressant drugs, mainly opportunistic infections. We talked in chapter 6 about opportunistic infections. And we're going to talk a little bit about organ transplantation and what the side effects are, basically. We're going to compare and contrast the different types of hypersensitivity reactions. There's a green chart in the book, the table 7.5 types of hypersensitivities, which is a lovely reference for that. We want to explain the process of anaphylaxis and how it can be life-threatening, the definition of autoimmune disorders, and common causes and general effects of immunodeficiency. So first we talked about the immune system. Now we're going to say what goes wrong with it, as is our pattern generally. So usually when someone has a damaged organ or tissues, some organs can be replaced by healthy tissues from donors. And interestingly enough, this year, someone has been working on developing genetically modified pigs to grow human organs. And a patient received the first genetically modified pig kidney, I want to say in around February of this year. Unfortunately, that person has already died, but that was the first time that ever happened. So you can't live without your kidneys. You have to have at least one. And that's an interesting development in the area of organ transplantation. But normally you get it from a human donor. So on your driver's license, when you say like, oh, organ donor, you check that box. You're in a car accident, somebody might end up with your kidney. The problem with So we said in the early part of the lecture that when you're a baby, when you're a developing fetus, your immune system is working, your thymus is working to develop the concept of self and non-self antigens. Your immune system can identify your own cells. When you get an organ from somebody else, the body's like, I don't know what that is. I don't know where that thing came from. And it could reject the new organ. So usually when someone gets an organ transplant, they're treated with immunosuppressive drugs to prevent that reaction and rejection of the organ. The commonly used drugs are cyclosporine, azathioprine, and prednisone. And prednisone is a corticosteroid to reduce inflammation. So we're reducing the inflammatory response. But when you do that, you have a higher risk for infection because your immune system is suppressed. And so even your normal flora, if they get someplace where they're not supposed to be, there can be opportunistic pathogens. They can say, hey, it's a free-for-all. The door's unlocked. Nobody's protecting us. So there's a higher risk of infection for someone who's on immunosuppressant drugs. You'll see ads for medications on TV. A lot of the ones for like Humira for lots of different autoimmune diseases, they are immunosuppressants, and that's how they make the autoimmune disease less harmful, but you are more at risk for infection from opportunistic organisms. So that's kind of the first learning objective, is why do immunosuppressant drugs cause a higher risk of infection? And that's why. So someone who's had an organ transplant is pretty much always going to have to be on immunosuppressant drugs. So there are different types of what we call hypersensitivity reactions, which are basically immune system reactions. And some of these we are very familiar with. Allergic reactions are immune system reactions. So hypersensitivity or allergic reactions are unusual. I mean, they're not as unusual as some things, but they're sometimes harmful immune responses to normally harmless substances. So sometimes you can develop an allergic response and it can be life-threatening, and sometimes it's pretty minor. Like hay fever is not usually life-threatening, but it can be. So the reactions to kind of normally harmless substances like pollen um, can stimulate an inflammatory response. So there are four basic types of hypersensitivities, and they differ in the mechanism of how they work. And the table in the book is table 7.5, types of hypersensitivities. It talks about the examples of them, the mechanism, and the effects. And I I want you to know those. So I want you to know that table. You don't have to know it in any more depth than what is in that table, but there you go. So a type 1 hypersensitivity reaction is basically what we consider to be an allergic reaction. It's caused by an allergen, whatever it is, cat dander, pollen, all the stuff you're allergic to. I think I'm allergic to every flowering tree in Bellingham, but I still like them. That's why they have antihistamines that you can take. So skin rashes can be a type 1 hypersensitivity reaction, and hay fever. The causative mechanism is exposure to the antigen, and you develop antibodies and mast cells. So you're exposed to the allergen, you develop IgE antibodies. You don't necessarily have to know that, but IgE antibodies bind to the mast cells, and the mast cells release histamine and other chemical mediators that stimulate an inflammatory response. So when you have hay fever, you get inflammation and itching sometimes, or pruritus is what they call, it's the medical term for itching. The complications potentially could be anaphylaxis. So we'll talk about the details of anaphylaxis, but basically anaphylaxis is too much histamine, and histamine is a vasodilator. Remember, it's opening those capillary beds. So if you have too much vasodilator, your blood pressure can drop way down, and that's anaphylaxis. And that's a medical emergency. So probably, I think a lot of us have experienced environmental allergens and that cause this type of type 1 hypersensitivity reaction. Hopefully not too many of us have experienced anaphylaxis, but I know some people have. This could also be like a reaction to people who are allergic to penicillin. That's a type 1 hypersensitivity reaction. And that can cause anaphylaxis. So hay fever is also known as allergic rhinitis. Remember, itis is inflammation, rhino is the nose, so allergic inflammation of the nose. So the nasal mucosa is affected by a type 1 hypersensitivity reaction. Food allergies are usually, it's the digestive tract mucosa that is affected. So a lot of times in the mouth, and that can be a problem because if you have additional swelling in the mouth, it can swell your respiratory tissues and you can have trouble breathing. Not good. Atopic dermatitis or eczema is a type 1 hypersensitivity reaction of the skin, and asthma is a type 1 hypersensitivity reaction of the bronchial mucosa. Type 1 asthma, intrinsic asthma, or extrinsic asthma, but we'll talk more about that when we talk about respiratory disorders. But it's the bronchial mucosa that are affected. So usually it's either it can be your skin with dermatitis or mucosal tissues which are affected in type 1 hypersensitivity reactions. Type 2 hypersensitivity reactions are also known as cytotoxic hypersensitivity reactions. So cytotoxic means you're killing cells. So there is an antigen present on a cell membrane that may be a normal body component, or it may be exogenous. So the example of cytotoxic hypersensitivity reactions are ABO blood incompatibility. So our blood cells have different antigens on them. And if you have ones that don't match what your body wants to see, then you get circulating immunoglobulins that react with that antigen and destroy the cells by phagocytosis or cytolytic enzymes. So when you have an ABO blood incompatibility, that's pretty bad because that cell lysis of your red blood cells, you need those red blood cells. So that's really the example for a type 2 hypersensitivity reaction, is that blood incompatibility reaction. And it's because you have circulating antibodies in your blood that react with antigens on the cell, on the targeted cell. So if my blood type is B positive, if I get a blood transfusion and it's A positive, my circulating immunoglobulins are going to bind to those A positive cells and they are going to destroy them. So that blood transfusion is not going to do me any good. So that's why their blood typing is important. And we'll talk more about that at the beginning of next quarter in chapter 10. We'll talk more about that. So type 3 hypersensitivity reaction, these are like autoimmune disorders. And basically an antigen combines with an antibody and they form immune complexes which are deposited in tissues. It also activates the complement system, which we briefly discussed. And the process causes inflammation and tissue destruction. So rheumatoid arthritis is one, glomerulonephritis, that's a great word, affects the glomerulus of the kidney, inflammation of that, and you don't want that to be destroyed because it's a pretty critical system in our body. Systemic lupus erythematosus, or SLE, or just lupus, people call it, affects a lot of different organs and tissue systems, so it can be a pretty widespread type 3 hypersensitivity reaction. So autoimmune disorders where our body is attacking our own tissues, this is how it happens with a type 3 immune complex hypersensitivity. So you get inflammation and sometimes vasculitis, which is inflammation of the vascular system because of the circulating immune complexes. So type 4 hypersensitivity reaction is a cell-mediated or delayed hypersensitivity reaction. It's a delayed response by sensitized T lymphocytes. So the sensitized T lymphocytes, whatever sensitizes them, causes release of lymphokines, which are chemical messengers, and an inflammatory response and destruction of the antigen. So the antigen binds to a T lymphocyte and sensitizes it, and that causing the T lymphocyte to release lymphokines. So transplant rejections are cell-mediated type 4 hypersensitivity reactions. So the fact that you have an antigen on those foreign cells sensitizes those T lymphocytes and causes destruction of those foreign cells. So that's where you're going to get that tissue rejection. So the tuberculin test that you get injected in your arm, that is another type 4 reaction if you have the antigen in your system. Contact dermatitis is a type 4 hypersensitivity reaction, and an allergic skin rash. So not to be confused with the atopic dermatitis or eczema, the skin reaction. So an example of that type 1 hypersensitivity reaction, I was on the hospital's team for the Arthritis Foundation, the Jingle Bell Run one year. And one year, I did it many years, but one year they gave us these scarves. Like everybody on the team, we got these scarves. And normally I would wash something before I wear it, but I didn't because they handed them out at the beginning of the race. And it was a cold day. I put the scarf around my neck, and about halfway into the race, I started getting hives. I started having a type 1 hypersensitivity reaction to whatever was on that scarf. And so instead of going to the finish line, I was closer to my house, so I peeled off I went home, I took some Benadryl, which is an antihistamine, and then I lie down and then I threw that scarf away. I never wore it again. I probably could have washed it and worn it, but I didn't. So that's a classic type 1 hypersensitivity reaction. And hives are what we see when in the skin chapter, we'll look at what hives look like. And if you've ever had them before, you know what they look like. So that's as opposed to the allergic skin rash that's a cell-mediated reaction. So sometimes people develop latex allergies, and those are usually type 4 hypersensitivity reactions. So fun stuff, right? Anaphylaxis or anaphylactic shock is the other name for it, is a severe, potentially life-threatening condition that's a systemic hypersensitivity reaction. The systemic hypersensitivity reaction causes decreased blood pressure by excessive release of histamine, and histamine is a vasodilator, if you recall. So you dilate your capillaries, blood goes out of the capillaries, and your blood pressure decreases dramatically. It can also cause airway obstruction and severe hypoxia. Anaphylactic shock can be caused by anything you're allergic to, like latex materials, insect stings, nuts or shellfish, or various drugs like penicillin can cause anaphylactic shock if you're allergic to it. One time when I used to work on the ambulance, they were having a dinner for us at like a work dinner to congratulate us for all our fine work or whatever. It was a fancy restaurant in Denver, and it was on the top of this tall building where you had a really nice view. It was really cloudy that day though, so we didn't have the nice view. But anyway, irrelevant. Some of the paramedics and EMTs showed up right after their shift, and they still had their gear with them. Okay, that's critical to the survival part of the story. And so we sit down to eat, and it was a set menu. And so they brought out the soup, and everybody started eating it, like, oh, this is delicious. And then one of the docs who worked in the emergency room kind of looked around and he said, does anybody have any epinephrine on them? And you're out there with a bunch of emergency responders, and one of the paramedics who just got off shift actually had his ACLS kit, and he had epinephrine, gave the guy an epinephrine injection, and they didn't have EpiPens back then. This was the olden days, and there was seafood in the soup, and that person was allergic to seafood. So that's he could have gone into anaphylactic shock, but luckily, so moral of the story is go out to dinner with paramedics because they're ready. But now we have EpiPens, so you can do that. So an insect sting, like if you're allergic to bee stings, a lot of people will carry an EpiPen just in case to avoid anaphylactic shock. So the signs and symptoms of anaphylaxis can be a generalized itching or tingling, especially in the oral cavity, coughing, difficulty breathing, a feeling of weakness, dizziness or fainting, and that's from the low blood pressure, a sense of fear or panic, and that's from the difficulty breathing usually, edema around the eyes, lips, tongue, hands, and feet, hives, or a collapse with loss of consciousness. So that's pretty serious. So you definitely want to, if you don't have an EpiPen on you, you want to call 911 and get someone over there who does have one. So autoimmune disorders are when the body develops antibodies against its own cells or tissues. So instead of being able to recognize self from non-self, the body says, I don't know. I don't know what that is. I don't know if it's self or non-self. And it develops antibodies against its own cells or tissues. So autoantibodies are antibodies that are formed against self antigens. So you lose your self-tolerance, basically. And the disorder can affect a single organ or a single group of tissues, or it can be generalized. So in Hashimoto thyroiditis, it affects the thyroid. In lupus or SLE, it affects a lot of different systems. Rheumatic fever, it can affect a lot of different systems, but a lot of time it affects the heart. Myasthenia gravis, it affects the acetylcholine receptors at the neuromuscular junction. Scleroderma, it affects connective tissues in the skin. Pernicious anemia, it's the cells in the stomach that create intrinsic factor, which help you process vitamin B12. With rheumatoid arthritis, it affects joint tissues, like the cartilage in joints. So whatever tissue is affected, that's what the effects of the disease are going to be. So like I said earlier when I was talking about organ rejection, autoimmune disorders are often treated by immunosuppressant drugs. And watch those ads on TV. I don't usually watch ads on TV because I stream everything now and I try to stream commercial free, but every once in a while I'll watch ads on TV just to see what's out there. And when you watch those medication ads, the ones for Humira and the ones for whatever, they always talk about may have an increased incidence of infection because they're all immunosuppressant drugs. So you're a little more open to opportunistic pathogens. So lupus or SLE is has a large number of circulation and autoantibodies against DNA, platelets, and erythrocytes. That's a big problem, right? When you're attacking your own DNA, when you're attacking your own platelets, it can affect clotting. If you're attacking your own erythrocytes, it can affect circulation of oxygen. Immune complexes form like in that type 3 hypersensitivity reaction, and they're deposited into your tissues, causing inflammation and necrosis that's widespread throughout the body. Vasculitis develops in many organs and it impairs blood supply to the tissues. So that's why lupus is difficult to diagnose at first because it affects so many different systems and you might have different symptoms associated with it. But generally, the ones that, I mean, they can vary because of different organ involvement, but commonly arthralgia, which is joint pain, fatigue, and malaise. Fatigue is tiredness, and malaise is you just feel icky. Yeah, you know. Cardiovascular problems because of the vasculitis, and polyuria, which is increased urination. They do diagnostic tests. They test serum antibodies. They're looking for those antibody antigen complexes that are throughout the body. It looks at leukocyte cells and other blood work. Usually, lupus is treated by rheumatologists, as are a lot of these autoimmune disorders. Prednisone, which is a glucocorticoid, is usually used during a flare, and non-steroidal anti-inflammatory drugs as long-term sort of low-level treatment. So when you have a partial loss or partial or total loss of one or more immune system components, it's called immunodeficiency. So you have an increased risk of infection because you're not catching those pathogens as they come in. And opportunistic pathogens have a better chance. You have an increased risk of cancer because your cytotoxic killer T cells might not be there to get newly developing cancer cells. So immunodeficiency can be caused by a primary deficiency, which is a basic developmental failure somewhere in the system, like you were just born with a deficient immune system, unfortunately. Or it could be secondary or acquired. So if you lose part of the immune response because of a specific cause, like you damaged your spleen and you had to have a splenectomy, you can live without a spleen, but your immune response is lower. And you have a little bit of immune deficiency if you've had a splenectomy, or some other part of the immune response is lost. It can occur at any time during the lifespan, from infections, splenectomy, malnutrition because your cells just aren't getting built correctly, liver disease, immunosuppressant drugs, radiation, chemotherapy from cancer treatment can cause acquired immunodeficiency. Viruses, the AIDS or the HIV virus, human immunodeficiency virus, is a secondary or acquired immunodeficiency. So when you have immunodeficiency, whether it's primary or secondary, you are predisposed to the development of opportunistic infections. One of the things in the early 80s when AIDS started being around, and one of the things they noticed is an increase in certain types of cancers and an increase in opportunistic infections like thrush, which is a yeast infection of like the oral cavity and some other things. So our normal flora are causing these infections because we're immunosuppressed. It's usually difficult to treat the opportunistic infections because of the immunodeficiency. So sometimes prophylactic antimicrobial drugs are used to treat immunodeficiency. There's now medical treatment for treating HIV, which is great because people aren't dying from it anymore. That actually affects the life cycle of the virus. And so immunodeficiency is going to be treated differently depending on what is causing it.